welcome you all to the I'm with Amanda Medicare podcast. This is our first Fireside Chat special guest episode, and I'm so excited to introduce you to Haley Campbell. She works for Advanced Diabetic Supply, and she spends probably all day, every day, either answering my questions, or helping Medicare beneficiaries figure out how to obtain the diabetic supplies that they need. So without any further ado, I'm going to welcome Haley into the meeting so that she can go through all the wonderful information I'm really excited for her to share with you.
Yeah, thank you so much for having me. Excited to be here and share a little bit of the things I get excited about. Diabetes supplies. Never thought that would be the case when I took this job 5 years ago, but it's really become a passion of mine, and I love helping people get items that they need and ensure that they're taking full advantage of the benefits that you help them select.
Wonderful.
Yeah.
I thought maybe we would start with just some maybe frequently asked questions. I mean, your team are fielding these calls all day, so I think I'll have you just jump in with some of the most common questions, and then I have a couple at the end if you don't cover them in your natural talk.
Absolutely. Perfect. So biggest question that I've been getting these days, and I think it has to do with the amount of commercials that there are out there for the new continuous glucose monitors. They're the sensors that go on the arm where you don't have to prick your finger anymore. It's great technology, fantastic for diabetes management, and everybody has questions. They want to know if they're covered, how much would they be, where can they get them? And oftentimes there's a lot of misinformation out there when it comes to continuous glucose monitors. The commercials are fantastic. You go and ask your doctor for a prescription for one. You get it called into your local pharmacy and you try to go and pick it up and you're told it's not covered, which isn't the case. It actually is covered by Medicare, but there are specific regulations around where you can get one of those devices. So you have to get them through a specialized durable medical equipment provider, which doctors' offices don't know that. They're, busy helping you maintain your health. They don't know the nitty-gritty details on where you have to go. So that's where myself and companies like the company I work for, Advanced Diabetes Supply, come in. You do have to meet one of two qualifiers to qualify for a continuous glucose monitor. So if you're on Medicare, as long as you're injecting insulin at least one time per day, you can get a continuous glucose monitor covered under your insurance plan. You just have to go to the right provider, which is what I do. Or if you're not on insulin, I get a lot of those calls, hey, my doctor prescribed this item for me. I want it, but I'm being told I don't qualify. Is there any way I can qualify if I'm not on insulin? And there is one additional qualifier that has to do with severe low blood sugar episodes. So if you're not on insulin, but you've experienced severe hypoglycemic events in the past, meaning your blood sugar has run so low that you've needed some kind of medical intervention, or maybe an example, my mom gets low blood sugar spells and she has seizures. Talked to a gentleman the other day who passed out on an airplane from his low blood sugar. So as long as you've had an incident like that in the past, where maybe even if you just had to sit down, you got lightheaded, had to discuss it with your doctor, as long as we get those outlined in your medical records, we can get this item covered for you. And that would be the Libre or the Dexcom. They're both great. I always get questions on which one's better. Just normally depends on whatever commercial you saw first is normally the one I get the request for from the member. They're both great, amazing technology, and truly it gives you kind of a roadmap to your entire day instead of just knowing, oh, my blood sugar was this level when I pricked my finger at 1 p.m. It'll show you what your sugar does throughout the day on a map. It completely is monitoring 24 hours a day, 7 days a week. The sensors last for either 10 days at a time or 14 days at a time. So can really be beneficial technology for someone who's maybe been pricking their finger, 5, 6, 7, 8, 9, 10 times per day for years. So if you're interested, absolutely call me. We can discuss and kind of figure out which one you'd like to go with and if you qualify, and then we take care of all of the paperwork and prior authorizations for you to get it covered under your plan. Wow. Another big question is what they're covered at. What's it going to cost? And that totally breaks down to the plan that you're on. They absolutely will be covered. They can range anywhere from being fully covered all the way to having a 20% share of cost. So somewhere in there, it will be covered, but at what rate, it just depends on the carrier that you select with Amanda. But I can help connect you after that.
So a lot of great information there. So to review, the qualifying criteria was insulin dependent, so at least one insulin injection per day, or series of recorded history with low blood sugar episodes.
Exactly.
And then you did say about the qualifying vendor. So sometimes people get confused with whether or not diabetic supplies are covered under their Part D prescription or if they're covered under their Part B medical. Can you expand on that a little bit for us?
Yeah, great question. So diabetes related supplies, for the most part, things like your meters, strips, lancets, lancing device, continuous glucose monitors, and most pumps, insulin pumps, are all covered through Part B, as in boy. So they are a medical benefit. None of that cost is going to be contributing you closer to your max out of pocket for Part D, as in dog. They are a Part B benefit. And I think that's where a lot of the confusion comes from as well, is because when you try to pick it up locally or go to a local pharmacy, they are experts in the Part D arena, drug arena. But the second you try to fill anything that's Part B, it gets really confusing at times for pharmacists, to no fault of their own. There's just, it's so confusing. It's created a full-time job for me here, right? To help people navigate it. So all of those items are going to be Part B. The ones that are Part D that I get a lot of questions about, right? Because in plan documents, it'll say diabetes testing supplies, $0, or continuous glucose monitor, 20%. We all think then, the needles that you use to inject your insulin would probably be a Part B benefit, but they're not. Medicare actually classifies the needles that you need to inject your insulin as a Part D, a drug benefit. And they do typically have pretty high copays. As we know, they cap the cost of insulin, which is great with the Inflation Reduction Act, but they didn't cap the cost of the needles, funny enough. So they can get expensive, but there are avenues around that. What local pharmacies won't tell you is that you can get needles, syringes over the counter at a cash price, oftentimes for a fraction of the cost as it is to go through insurance. So little tips and tricks like that are what I'm all about, anything that's going to save costs for the member.
Do you find that there's a varying degree of specifically which, like, lancets, which needles, which diabetic supplies really varies per Part D and medical coverage?
Yeah. So every single carrier has a different formulary brand when it comes to the meter, strips, lancets, all the way down to the lancing device. So that can be a thing that often causes members to be paying for these items when they shouldn't be. All that needs to happen is a quick formulary change on the prescription from the doctor's office in order to get the items fully covered. The brands, all of the carriers out there really are covering the leading brand new top of the line brands of the meters and strips. So you're going to get upgraded if a formulary change is needed, which is all good things, right? Less blood to get a reading, faster results on the meter and strips. But all of those, again, are going to be Part B. And then the syringes also have a formulary brand, which can also lead to someone paying more than they should be. But those are all things that we help coordinate here at ADS, is making sure everything's aligned from Part B all the way to Part D on the formulary scale, and making sure that you get everything at what you are deserved through your plan.
That's great. That's really helpful. I know the feedback that I get, certainly that the continuous glucose monitor makes a really big difference in the control of diabetes. That people have maybe held out for a while because they were more expensive, but now with some of the new expanded coverage guidelines and stuff, it might be on the table where before it wasn't. So that's great.
So with continuous glucose monitors as well, another really cool feature on those is one, they have made them so small now. The most recent one that came out, back in the day, the sensors were like this big. You had to have them on your arm. The most recent versions are as small as a penny. They're so small that almost not even noticeable. So if maybe in the past you had thoughts about a continuous glucose monitor maybe being a good course of treatment for you, but didn't want this big old thing on your arm, you almost can miss them now when you have them. My grandma has one and I forget that she's even wearing it most of the time.
Wow.
A big question I also get is, do they hurt? In theory, you are applying something to your skin and you want to know, is that going to be painful for me? It's going to be sitting there for 10, 14 days at a time. And I personally tried the continuous glucose monitors because I wanted to know, I'm helping people all day, every day, wanting to know if it hurts. When I tell you it is less painful than a finger prick, and you completely forget it's there. It's a teeny tiny little flexible filament. Almost, I always compare it to kind of like a cat whisker, like a flexible filament. And that is what's penetrating your skin and just sitting there slightly under your skin for those 10 to 14 days to check your blood sugar. So it's not painful at all. It hurts more when I prick my fingers. And it really is great technology. It can also notify you when you're having severe highs or severe lows, when in the past you kind of just had to know your body, feel your body. That's still great to do, but now it can give you a little vibrate on the arm when maybe you're starting to reach an area that's a danger zone or something you could take a course of action to help prevent. So it really is. I think in the next 10 years, we won't even see finger pricks as being a way to monitor your sugar levels anymore. So we'll certainly get there eventually. But yeah, just great technology overall. And it's really important that, you get in touch with someone like Amanda to make sure that you're constantly reviewing your coverage and figuring out what the best direction is going to be in for the following year. And then in turn, if you have diabetes, Amanda can connect you to me and we will make sure that everything aligns for your supplies as your coverage may change with whatever you select with Amanda. So it really is, it can change on a year-to-year basis. So having those direct points of contact like Amanda and myself can be really beneficial for you as someone on Medicare.
Yeah, because it certainly can be a little confusing and hard to follow.
Yeah.
I know something about the diabetic supply questions that I get from clients sometimes. Some would be like, well, do I know that my CGM will work with my particular like mobile device?
Yeah.
Do you find that they're all interchangeable now, or?
Yeah, for the most part, they have expanded to almost all different types of phones, whether it's iPhone or, an Android, all the different iOS and software updates they are aligned with. And another frequent question that I get is, they say, I don't want a CGM because I don't want to use my phone. I don't want to use my phone. I like having my meter and strips in my hand. And you actually don't have to use your phone if you want a continuous glucose monitor. They do come with a separate external reader that you can use in place of a smartphone, and tons of members opt into using it that way versus downloading the app on their phone. So they have two choices. Whichever direction they want to move in, they can.
I didn't know that. And I'm being a very non-techie person. I appreciate that they have
me too.
To choose how they want to get those readings. So that's good. Here's another one. This might be a little bit of a curveball. So sometimes I'll have a client who will call and say, Amanda, I put my meter on and it fell off. It just didn't work. And now I don't have enough until they get filled again. What do you see as like a typical response from a supply company if a member needed to replace something that's broken and it's not time to rebuild an entire supply?
Yeah, so the manufacturers of continuous glucose monitors, Abbott and Dexcom, they require that replacement sensors for faulty ones that maybe come off prematurely, or maybe you have a test at the hospital where you're going to be going into a machine like an MRI and they ask you to take it off. For any of those situations where a sensor comes off prematurely, you actually need to call the manufacturer directly. They are responsible for sending out replacement sensors. They do this for one of two reasons. One, it allows them to kind of understand what issues are going on with their technology and create improvements for future technology. And two, they can then send you the replacements and request that you send the dud so they can evaluate it and just, again, streamline technology that will be coming out in the future. It can get frustrating sometimes. Trust me, working for a supplier, when someone calls me and say they have a faulty sensor, I would love to just say, okay, no problem, we'll send a replacement right now. But how they have it structured, you do have to go through the manufacturer. Hopefully the supplier you're with points you in that direction. I have gotten feedback from members before that call me after coming from a different supplier where they're like, well, my old company never told me to call the manufacturer. They just told me when they could ship out my next order, So just make sure you save the number for the manufacturer. You can create an account with them, and anytime a faulty sensor comes off, You call them, you'll answer a couple questions, and then they'll get a replacement sent out for you. It can be very frustrating with Medicare. As you know, they don't like to make things easy on us, and they create very strict billing and dispensing guidelines. So we can never dispense earlier than the 90 days that the order was shipped out on, which can be tough if the sensor comes off prematurely or, whatever factors come into play. If you ever have a situation where maybe you're even traveling, that can affect your reorder of supplies as well. So I encourage you always to just be completely open with your supplier. Be transparent if you're going on a trip and maybe need the sensors or supplies early. See if there's anything they can do to help you out. Our company certainly tries to help in those specific situations when we can. And you can also request that supplies get shipped to a destination if it's within the US. I've shipped them to hotels before for people while they're on vacation. So whatever it is that you guys need, just be open with your supplier and they should be able to make some arrangements for you.
Okay, that's good information. What if somebody, let's start right at the very beginning. What if somebody was just told that their A1C's up and, the doctor's, letting them know that they are diabetic now? Yeah. Where do you see as like the first steps and the first start? So what kind of questions maybe they should ask, and what should they know about their supplies right from the beginning?
Yeah, so great question. First thing is to make sure that you are discussing with your doctor what the expectations are to start getting a handle on the diabetes and an understanding of where you're going. Maybe it's even pre-diabetes, the first initial, hey, we need to start taking a look at this. Make sure you're asking your doctor, how frequently should I be checking my blood sugar? And what is a safe range for my sugar levels to be in? You want to make sure that you confirm those two things so you can take appropriate course of action once you do get your sugar level readings. The next step typically is the doctor will call in a prescription to the local pharmacy for your meter and strips, so you can go pick those up. And that is typically where I come in, because when you try to go pick up the meter and strips at the local pharmacy, depending on the brand that the doctor called in for you, oftentimes you're going to get told they're not covered, which isn't true. That's not the case. So what you can do if you are in that preliminary stage, talk to your doctor and say, I'm going to call someone, they'll be reaching out for a prescription from you guys, and then we take care of the rest. But sincerely, make sure you're asking your doctor, how frequently should I be checking and what's the range you want to see my levels in? And then next would be, what steps can I take to get myself to those levels? Those are going to be the most important things to keep in mind as you first are diagnosed. And it really can make a difference for, the course of the diabetes diagnosis. If it goes unmanaged and untreated, it can progress to the point where you need insulin or become fully insulin dependent. And at times, depending on the type of diagnosis, it can be preventable based on, management of it. Sometimes it's unavoidable. Your pancreas just stops making insulin. That does happen. But in situations like my grandma, she was extremely proactive about it. She got herself a continuous glucose monitor. She was put on insulin right away, but eventually she was able to lower her insulin usage down to like 1 time per day. So, it can make a huge difference, but just make sure you're being completely open with your doctor and asking those kind of hard to ask questions sometimes.
Okay, that's all good. So this is hopefully going to reach people throughout the country. Hopefully my wonderful clients are listening, and hopefully other people find us too. So you don't have a specific geographic location, right? I mean, you can help people wherever they are.
Yep, anywhere in the United States, we can assist you. So I do work with insurance agents specifically that live in New York and New England and even South Carolina, but they have clients and have referred people from all 50 states. So I can help you wherever you're located.
Okay. And then is there a fee? How do people engage with you? What information should they have ready before they reach out so that you can best help them?
Yeah, great question. So when you call me, just make sure you have your insurance cards handy. That's really all I'm going to need to know. And then the name of your doctor. But the rest you should have up in your head, just demographic information.
Okay.
Cost. I always get this question. They say, well, what's it going to cost me? What does it cost to use your service to help coordinate things? It doesn't cost anything. We make our money by billing your insurance plan, but doing it correctly so you end up owing either nothing or, exactly what the copay is supposed to be through your plan. But the cost to use our service, to get supplies shipped directly to the house, we do not charge for. So only thing you will be paying for if you have a copay, 8% of the time, I'm working with members that do not have a share of cost. If you have a copay, that will be your only responsible cost, but most of the time, a lot of this stuff is fully covered.
Wow. And I should know the answer to this question already. I just live in my Medicare bubble. So I obviously only talk to you about the services that you provide as it relates to Medicare beneficiaries, but can you help people on group or marketplace plans, or is it only Medicare beneficiaries?
Yeah, great question. So we can help anybody in any age range, any type of insurance plan.
Okay.
I can't make always the same sweeping statements as I can with Medicare saying, these are the qualifiers for a CGM. This is what the copay will be between. There's a lot more flavor and variety in regards to coverage, but what we will do is help them nail down or help you nail down exactly what your copay should be and make sure you're getting it at exactly the rate you're entitled to through your plan. But the criteria for coverage for CGMs as well as the copay can vary quite a bit, just depending if it's under 65, but we'll help you navigate it.
Okay, great. Any final thoughts that you think would be helpful? It sounds like you're very optimistic about the future of diabetic supplies and technology and impact. So that's good.
Yeah, it's unfortunately diabetes isn't going anywhere. So it's really pushing these manufacturers to progress their technology in a very fast manner. I mean, sometimes we're getting versions of one CGM stocked, and then by the next week, I'm already getting an email that there's a new version that's coming out. So it progresses quickly. It's really good to be connected with a supplier that, especially at least at our company, we literally only do diabetes supplies. So I know sometimes you can call providers and they do, X, Y, Z and the other thing. And so it can kind of be hard to nail down straight answers on stuff because they do so many different types of business. We're only diabetes. So we will keep you connected to the most up-to-date versions, and they're coming quickly throughout, I would say over the course of the year. I think we went through 3 different versions of one device. So it's progressing. And I think as the years go on, CGMs will become more widely accessible to members. I don't think we'll have the same constraints that Medicare currently has with the injecting and hypoglycemic events. We're headed in the right direction. It's already easier to get them than it was 5 years ago, which it was nearly impossible. You had to meet really stringent requirements. Yeah. If you are someone that's interested in a CGM and maybe you don't quite qualify, still give me a call. I have a running Excel spreadsheet of people that I will be calling when something changes with Medicare's criteria, because it's inevitable. I have like 300 people I've spoken to on there that didn't quite qualify. And then when the criteria updated about a year and a half ago, I was able to take like 150 people off that list and get them a CGM. So still call me. I'll get you on that quote unquote waiting list, and you'll get a call as soon as something changes and you qualify.
Wonderful. So I'm sure by this point, anyone who's watching knows why I appreciate you and why I utilize your expertise and your services as much as I can, and why I really do recommend that people reach out to you. Even sometimes if things are going smoothly, there might be something that they haven't thought of that you would. So I want to thank you for all the help you've given to me and my team and my clients over the last several years.
Of course.
And we will put your contact information up on the screen so that people know how to reach out and where. And if anything else comes through, I can always mention it in the next episode.
I love it. Thank you so much for having me. And I will be here and ready to help anytime you guys need me.
Thanks for listening to another episode of the I'm with Amanda Medicare podcast. Please make sure to subscribe wherever you get your podcast so you don't miss an episode. Also, please leave a review, as that helps me reach more people that can benefit from this podcast's content. If you have questions or topics you want me to cover for a future episode, please email them to info@imwithamanda.com. I look forward to hearing from you. Like any good industry, we do have compliance requirements, so here's my disclosure. We are not a government agency. We are licensed insurance agents who discuss insurance programs such as Medicare Advantage, Medicare Supplements, and Medicare Part D prescription drug coverage. Any specific plan information I provide is limited to the plans I offer in your area. Please contact Medicare.gov or 1-800-MEDICARE to get information on all of your options. Thank you.